So now we're at a point where we've decided your ACL needs to be reconstructed. You're trying to stay active, you want to keep going, you don't want the knee to give out on you or put the meniscus at risk or the cartilage at risk for further damage. So what are we going to replace it with? Our choices, the first big watershed is, do we replace it with some of your own tissue called an autograft, or do we replace it with somebody else's tissue, or a cadaver graft, also called an allograft? So cadaver graft and allograft are the same term. Using your own tissue is called an autograft. When we use an allograft, it's a quicker, easier rehabilitation. It doesn't hurt as much. It still takes just as long for the new ligament to remodel and get you back playing sports, but it's easier that first few weeks. There's pluses and minuses of everything. The plus side of the allograft, we talked about how much easier those first couple weeks are. The downside is that it takes longer for your body to remodel it, turn it into a new ACL. So what we know nationally is when people under the age of 20 have a cadaver graft, they're at super high risk of re-tearing that ligament in the first year, especially 2 years, when they get back playing their sports. So we've almost gotten to the point, it's pretty rare we'll go with a cadaver graft in a very athletic under 20 ski racer, football player, etc. will use their own tissue. Conversely, though, it's one of the few things we have advantages of being more mature. Over age 35, and especially over 40, it's almost unheard of to re-tear that ACL graft even when it's a cadaver graft. So we'll tend to lean a little bit more towards a cadaver graft in the more mature athletes. Maybe it has to do with them paying attention to the rehabilitation more. We're not doing any high-risk stuff too soon. But in the under 20 crowd, we usually use their own tissue. So you may be falling somewhere in the middle, and it's worth a discussion about which way you want to go. So now we decide we're going to use your own tissue. What are our tissue options? We use a lot of hamstring grafts, and that's a 4-stranded graft that's big and strong, and everything we're going to talk about is stronger than your native ACL was. So it's not a matter of which is stronger. It has pluses and minuses of each. The second option is using your own patellar tendon, which is the middle part of your patellar tendon, goes right in the center of your knee. On this knee model, this is the patellar tendon. And the third option we use more and more is the quadriceps tendon. So it's just above the patellar tendon, just above the kneecap. We take the middle part of this quadriceps tendon right here. Like I said, all three are big and strong, and all three are stronger than your old ACL. The pros of the hamstring are they tend not to hurt too much. Most of my ski racers like using the hamstring graft because they don't have a risk of patellar tendinitis afterwards. And about 6 or 8% of people can develop some patellar tendinitis for a year with the patellar tendon graft. So that's the pros of the hamstring graft, and you get equal hamstring flexion strength 3 or 4 months down the line, even when we use it. The bad side of the hamstring graft is that there may be a little higher re-rupture rate in that for people that are real loose jointed. We see a lot of the ski racers and other athletes that dislocate their shoulders, or they have that knee that hyperextends 20 degrees or more. When you have that kind of ligamentous laxity, the hamstring graft tends to have a little higher re-rupture rate. So we might lean more towards a patellar tendon graft in those people. The more contact athletes might be a little bit more patellar tendon graft. When people have that amount of hyperextension, or they've been through a previous ACL reconstruction, but they really don't want to risk the patellar tendinitis, more and more we're using the quadriceps tendon, which is a wonderful graft source too. Again, it's big and strong. It's a little bit different incision. We have to make not only the incision to make a tunnel in the bone down here, but we also have to make an incision up here about an inch or two long to harvest the middle part of that quadriceps tendon. So find out which is the right graft for you. I think the younger you are, the more aggressive you are, the more you want to go with your own tissue. You want to stay active, and you're over 35, over 40, cadaver graft is going to work out great for you. So find out which is the right graft for you. They all are plenty strong.